Thank you, Chase. And according to the Cleveland Clinic, sarcoidosis is considered a rare disease, and there are usually fewer than 200,000 cases of sarcoidosis at any given time in the U.S. And here to tell us a bit more about the disorder is Nurse Christina Pears. Thanks for joining us this morning.
Hey, good morning.
It's always a pleasure to see you on these Tuesday mornings.
Thank you.
And
glad to be here.
It's interesting today because I've never heard of sarcoidosis.
I didn't know a whole lot about it either, and I would have patients call and wonder if whatever their symptoms were for that day, if it was due to their sarcoidosis. So I thought, well, I need to see what this is all about.
So help shed a little light on this. What is sarcoidosis?
So sarcoidosis is, it's a systemic thing. So it can happen anywhere in any organ of the body. And remember, skin is an organ too. So it can happen there. What happens is our immune system is trying to attack nothing. And so it gets this immune response, which causes these granulomas. And a granuloma, we have these white blood cells, they're the ones that help fight. They're our big fighters when a pathogen comes into our body. And we have macrophages and we have T cells. And so these macrophages form together and T cells form on top, and that's a granuloma. Now, when you get a bunch of these and they cluster together, they're gonna cause swelling, they're gonna cause irritation, and it can occur in, like I said, different areas of the body. Typically females in their 20s and 30s. But males can get it too, and it can happen or be diagnosed at any time.
All right, so what are the symptoms we'd be looking out for this?
So it really depends on what organ it's particularly bothering. So just general symptoms, you might just start feeling a lot of fatigue, maybe have a fever, swollen lymph nodes, like I said, due to the granulomas that are kind of clustering together. And that can happen, in your chest, your armpits, we have a lot of lymph nodes there. Underneath your neck, there's lymph nodes. You might have weight loss with no known cause. Pain and swelling in the joints. Now, if it happens in the lungs, you're gonna maybe have a cough or have shortness of breath with no reason to have shortness of breath. You might hear squeaking sounds, wheezing, things like that. Skin, you're gonna have a flat layer of like skin tissue, maybe looks like a rash, and it can be, usually is on the lower extremities, so like below the knee and down. But it can happen anywhere. You can get it on your face, and your lips, it can grow anywhere. You can also get them in your eyes where they can cause some blurred vision, maybe some eye pain, watery eyes, maybe some redness, light sensitivity, things like that. And you can also get it in your heart. So you're gonna have heart-related things like it can cause arrhythmias, which are electrical disruptions in your heartbeat, shortness of breath, fainting, like I said, the irregular heart rhythms. It can go into the nervous system, and so it can cause like headaches, dizziness, vision changes, confusion, weakness, and things like that. So there's lots of different,
depending a lot of things.
Depending on where it's at. And the thing is, I was looking at pictures of it on the skin. It looks a lot like shingles or psoriasis or different. So that's why these things are so tough to figure out, because they look so similar to other disorders. And it's really important that if you have symptoms, go to your doctor, and if they try something or they do tests and it comes up nothing, go back to your doctor. Like you have to keep going back. Doctors are given 15 minutes, 10 sometimes, depending on the company, to see a patient. So your doctor has 10 minutes to try to look at everything. So that means you might have to go back numerous times to get these weird, strange things figured out.
All right, well, that's good advice. And how would it be treated if, they do manage to narrow it down during these 10, 15-minute processes?
Right, so they'll do x-rays, blood tests, things like that. And then they can try steroids, steroid treatments. That's what we use when our body is doing wonky stuff that it's not supposed to kind of fight back against itself.
Right.
We typically go to steroids first. There are some other medications too, depending on the severity of the sarcoidosis, but they'll usually start with steroids. And it can go into remission. So you might have it, depending on how bad it is, you may only have symptoms for a few years and then it will go away, and you can be in remission. And it just depends on what the environmental factors are, the genetic factors that have caused this to occur is what will, impact or affect how it's treated.
Well, thanks you for that. It's a lot of information about sarcoidosis, and I certainly feel a little bit more knowledgeable about it as well. And as always, it's a good thing. When in doubt, go see your provider.
Absolutely. And like I said, some of these things, medication management, things like that, you might have to go more than once. And you definitely want to go to your doctor anytime you're having trouble breathing, changes in your heartbeat or chest pain, or you're just not feeling well, dizziness, changes in vision, weakness, numbness, or pain. Those can be pretty serious. They can indicate different serious issues. And so you always want to make sure you follow up, go to the ER, go to your doctor for those things.
Well, solid advice as always, Nurse Christina. Well, thanks for making it on this morning. We appreciate you taking the time and, hopefully making the Northwoods a little bit healthier in the process.
Yeah. Awesome.
Well, coming up after the break, we're going to have your What's Trending. Stick with us for more.